Hello and welcome to the Family Education series at On Track. This video is going to be on crisis management. My name is Shannon and I'm a social worker here with the On Track program.
Hi everyone, I'm Christine. I'm a social worker here at On Track. Thank you for joining us on this video. First, we'll talk about preparing for a crisis situation. So emergency plans can include a list of emergency contact information for your loved one's doctor, clinician, and the police, location to the nearest hospital, for example, the Civic, the General, the Queensway Carleton, the Mall 4. Friends, it can also include friends and family, relatives who will take care of other children or dependents while you deal with the crisis. That could also be for dealing with a senior family member that might be in your care. Could involve going to the emergency department with your loved one if needed. It's also important to engage your loved one in the plan just so that they are invested and they can kind of anticipate what's going to happen next, or at some point with recollection they might realize that they were a part of the plan, so it wasn't a surprise to them.
Tips for handling a crisis. So it's not possible to reason with someone in an acute episode of psychosis. So the person may be terrified by their own feelings of loss of control. No amount of evidence that you can provide can sort of convince them that their delusion or hallucination is not real. You want to avoid getting into a tug-of-war situation and really focus on de-escalating things as they happen. So don't express irritation, anger, or shout. Try your best to remain calm. You want to avoid direct, continuous eye contact and physical touch. It may seem or be understood or perceived as threatening. You also may inadvertently create suspicion. You want to ask any casual visitors to leave. The fewer people around, the better. And you want to decrease your distractions. So turn off the TV, the radio, fluorescent lights that hum, essentially trying to reduce anything that might stimulate them in that moment or anything that might play into a delusion or hallucination that they're having.
Now we'll talk about how to get help. So the first one, if it's an emergency situation, definitely to call 911. You can also, if it's less urgent, to contact your primary clinician, which is your social worker or your nurse that you've been assigned to at On Track, for direction or for some advice. If it's evenings or after hours or weekends, please contact the mental health crisis line and they'd be happy to give some direction or ask to be referred to the second tier, which is the mobile crisis team. You would want to encourage your loved one to come into the clinic to see their primary clinician or their physician, or to go to the nearest emergency department, depending on what is happening at home.
So now we're going to go through different parts of the Ontario Mental Health Act. So the Mental Health Act is the law that describes what should happen when someone who is living with a mental illness needs treatment and protection for themselves or others. So there's a few ways that they can access the Mental Health Act, which we'll go through in further detail, but these are the Form 1, a Form 2, a Section 17, and a Community Treatment Order.
First, we'll start off by talking about the Healthcare and Consent Act. So, which is consent to treatment is not covered under the Mental Health Act, but rather the Healthcare and Consent Act. A Form 1 and a Form 3 allows the person to be held at a psychiatric facility for assessment, but does not permit any treatment without the person's consent. Under the Healthcare and Consent Act, a physician can deem a person not capable of making treatment decisions, which would be a Form 33. The physician must notify a rights advisor who will meet with the patient and explain their rights. If an appeal is requested, a rights advisor will help them to acquire legal services, which is through legal aid, and is at no cost to the individual. The patient and physician will present their case to the Consent Capacity Board, which is composed of, at a minimum, of a lawyer, a psychiatrist, and a member of the community, often a family member of someone with mental illness. Usually a Consent Capacity Board would occur within 7 days of someone requesting a hearing, and if you're in the hospital at that time, that's where the assessment would be done from the Consent Capacity Board.
So we'll talk about Form 1. So what's written on the slide is sort of the legal jargon associated with the criteria of a Form 1. The first part, where a physician examines a person and has reasonable cause to believe that the person A and B essentially have to do with the risk of causing bodily harm to themselves or to others. And then section C talks about showing a lack of competence to care for themselves. Now that might mean they haven't showered in a while, they're not eating because there's some delusions around their food being poisoned, or in the instance of someone, having diabetes and not taking their insulin as required, that would show a lack of competence to care for themselves. So that would be section C. Now, the second part of this, Form 1, is where a physician examines a person and has reasonable cause to believe that the person has previously received treatment for a mental disorder of an ongoing or recurring nature that, when not treated, may result in risk of harm to themselves or others. And they've also shown clinical improvement as a result of treatment. So both of these sort of criteria are at the discretion of the treating physician. Form 1s can be discharged by physicians as well after an assessment. Patients can't contest Form 1s in the same way that they can contest other things under the Mental Health Act, and it's for a period up to 72 hours.
Now we'll talk about a Form 2. So criteria for a Form 2. Where there is no immediate danger, anyone can bring evidence to a justice of the peace that the person is a danger to himself or herself, a danger to others, or is not able to care for him or herself. The judge can then order a person to be examined by a physician and fill out a Form 2 authorizing the police to take the person to a physician for examination, which is usually bringing someone to an emergency department at one of the local hospitals. It must be obtained in person at the courthouse and taken to the police station.
So now we'll talk about a section 17, which is what the police are able to use in instances where they believe there's reasonable grounds that a person is acting in a disorderly manner and is a threat or at risk of causing harm to themselves or others. Once the apprehension is made, the officer escorts the individual to their local hospital for an examination by a physician.
Now we'll talk about a community treatment order, otherwise known as a CTO. A CTO provides a person who suffers from a serious mental disorder with a comprehensive plan of community-based treatment or care and supervision that is less restrictive than being detained in a psychiatric facility. So the focus is to have people living in the community and living at home or living on their own or with families. A CTO allows anyone named in the treatment plan to communicate with each other for the purpose of providing treatment, care, or supervision of the person. So for example, social workers and nurses like ourselves would be included in the plan. Obviously, the treating physician is included in the plan, and oftentimes parents, or if it's someone's friend or an important person in someone's life, can be included on a community treatment order. This way, communication can be open, especially when someone is not doing well or requires immediate attention. A CTO lasts 6 months and can be renewed if needed. A person on a community treatment order has the right to see a rights advisor and to appeal to the Consent Capacity Board. A CTO can also lapse for various reasons. For example, if someone moves out of the province, a community treatment order in Ontario is only valid within the province. So if someone moved to Quebec, then the community treatment order would lapse. Also, as a person is assessed by a psychiatrist, they might decide someone continues to get well. It might be decided that someone has developed insight. They're now capable to make treatment decisions for themselves, and they are willing to continue with the medication. That's also sometimes when a community treatment order can lapse before 6 months is up.
Another resource at your disposal is our mobile crisis team. So the mobile crisis team is affiliated with the Ottawa Hospital. They work 7 days a week, 9 a.m. to 9 p.m. Now, we say that the first tier in a moment of crisis is to contact the crisis line. The mental health crisis line telephone number is there, and ask for a referral to our mobile crisis team. Now, the mobile crisis team is designed to provide assessment and intervention in the client's own residence or other in situ locations. Now, this is when deemed appropriate by their team. They also work with the mental health unit of the Ottawa Police. So it is possible, depending on the circumstances, that the MCT team may arrive at your location with either a plainclothes cop or someone who is on the mental health unit of the Ottawa Police Service.
Now we'll talk about community crisis beds. The way to access community crisis beds is through the mobile crisis team. So mobile crisis team has 10 beds in 2 locations designed to provide short-term crisis placements in the community. Now we'll talk about some of the admission criteria for these beds. So you have to be a resident of Ottawa, have a serious mental health issue, or are experiencing mental health crisis, do not require inpatient admission, but would benefit from a supervised setting. For example, sometimes people would require queuing or assistance with taking their daily medications, so that can be provided at these locations as well. Ability to self-care. The individual must have the ability to do their own self-care for basic physical and personal needs. Willing to be voluntarily admitted to a crisis bed. So unfortunately, it's not something that someone can be deemed incapable or forced into. It does have to be with the agreement of the individual. So sometimes with support and encouragement from staff and from families, sometimes someone will consider a crisis bed admission even for a few days. Maybe someone has to be, if someone is experiencing suicidal thoughts, they do have to be stable, meaning that they can contract for no harm and no harm to self and no harm to others.
So that concludes our crisis management presentation for our family education series. All the contact information and any other information that we find relevant to this series will be in the description of the YouTube video. If you have any questions, concerns, or anything that comes to mind seeing this presentation, feel free to reach out to your PC, your social worker, your nurse, and have a discussion around things that came up for you that you have more questions around. We hope that this was helpful.
Thank you for joining us this evening, and we look forward to any feedback that you have. Thank you.
Thank you.